Welcome to this explainer. The global wellness industry is literally worth trillions of dollars today, right? But somehow, despite all that money, chronic disease rates just keep climbing. So today, we're going to dive into a totally revolutionary framework that completely changes how we build our physical and mental wealth. If you've ever felt completely overwhelmed by the constantly shifting, often contradictory demands of public health advice, well, you are definitely in the right place. We're unpacking the health capital model. It's a paradigm shift that throws out the old, rigid rules of wellness and brings in a highly accessible, dynamic way to fundamentally improve our lives.
Let's be honest for a second and think about our own experiences. Why do most health regimens actually fail us? For decades, traditional public health advice has just felt, overly medicalized, wildly expensive, incredibly time-consuming, and honestly, full of guilt. We are constantly being told what we're doing wrong. We're sold these pricey programs, rigid diets, or workout schedules that just absolutely do not fit into the reality of a fast-paced or working-class lifestyle. It's incredibly frustrating. It feels like this uphill battle where the odds are structurally stacked against you. But what if health wasn't a luxury item? What if the absolute key to profound well-being didn't cost a single cent?
So here is our roadmap for today. We'll start by rethinking public health, then look at the root of behavior, break down the health capital equation, explore how to get maximum impact for zero cost, and finally, talk about eliminating shame and blame. First up, rethinking public health and looking at this new paradigm. Contemporary public health experts are really starting to grapple with the massive limitations of single-access models. Those older approaches that view health as purely biomedical, strictly behavioral, or just exclusively material. When you view health through those isolated lenses, it's virtually impossible to actually address chronic disease or the rapidly widening health inequalities in our society. The health capital model entirely flips the script. It conceptualizes health not just as the absence of disease or some static biological baseline, but as a cumulative, dynamic stock of physical, mental, and social well-being. It is incredibly empowering, it focuses entirely on root causes, and it's built from the ground up to actually enhance population health through mechanisms anyone can access. Moving on to part 2, the root of behavior and our upstream modulators. Okay, so health isn't just this random assortment of daily choices. It's actually a directional hierarchy. Positive emotional states and psychological resilience are what we call upstream modulators. They are the absolute foundation. Those emotions dictate how we handle our socioeconomic circumstances. In turn, those resources directly influence our capacity to navigate our environment, which then shapes our behavior and our health choices. And ultimately, that entire sequence cascades all the way down into our internal biological processes and physiological adaptations. So the big takeaway here? It all starts upstream, with that emotional and psychological foundation. And guys, this isn't just some abstract feel-good theory. Grounded firmly in robust evidence from both biology and epidemiology, we can see that positive psychology physically shields our bodies. Positive emotional states and supportive social interactions exert incredibly powerful biological regulatory effects. They literally act as a buffer for the human body against environmental adversity and chronic stress. So your emotions and your social well-being are active biological shields protecting your physiological health on a cellular level.
All right, Section 3. The health capital equation and the mathematical focus behind it.
At its analytical core, the health capital framework actually gives researchers and clinicians an objective mathematical equation. I want you to imagine a giant scale. On one side, you've got risk factors, things like environmental adversity and chronic stress. On the other side, you've got protective factors, your emotional resilience, social well-being, and psychological resources. By quantifying this, the model brilliantly shows exactly how accumulating those positive protective factors can mathematically balance out and offset structural or environmental adversities. It's this incredibly flexible tool for predictive public health planning. You are quite literally building a stock of capital to offset life's risks. Section 4. Zero cost, maximum impact, and universal equity. A core innovation of the health capital framework, and honestly probably my favorite part, is its absolute commitment to universal applicability. How? By having zero financial barriers. Because this model prioritizes internal and microenvironmental adjustments, it incurs absolutely zero financial cost. And this is a huge deal. It means impoverished or marginalized populations can fully participate without facing any economic exclusion. By completely removing financial prerequisites, this model directly attacks the structural gradient of health disparities. It ensures that building health capital is a universal human right, not just a paid privilege for those who can afford it.
So the secret engine running this zero-cost approach is something called micro-adjustments. Now, sustainability is usually the biggest hurdle in public health, right? We simply feel like we don't have the time. Well, the health capital model is engineered to be entirely frictionless. It totally rejects those rigid, time-intensive regimens that clash with modern working class or fast-paced lives. Instead, it advocates for these seamless, high-yield adjustments that you just integrate right into your existing daily routine. They naturally compound over time to build substantial health capital, and they demand absolutely zero disruptive lifestyle overhauls.
A perfect example of this frictionless integration is simply swapping motorized transport for brisk walking on short distances. We've all done it, right? Circling the grocery store parking lot for 10 minutes just to save a 2-minute walk to the door. Yeah, instead, we just take the walk. It doesn't require an expensive gym membership. It doesn't require blocking out extra hours of your incredibly busy day. It's a micro adjustment that takes something you already have to do, getting from point A to point B, and just modifies it slightly. And these small modifications compound day after day, week after week, generating massive biological and psychological health capital over time.
Finally, Section 5, eliminating shame and blame through an empathetic paradigm.
Traditional public health campaigns frequently falter because, let's face it, they stigmatize populations for so-called unhealthy lifestyles. They point fingers. But this framework acknowledges that behaviors are downstream outputs of complex emotional and socioeconomic circumstances. And by doing that, it completely eliminates victim blaming. This is a profound shift in how we look at wellness. It means we stop judging the behavior and we start validating that those behaviors are actually constrained by real, tangible environmental and economic barriers. Let's break down the pillars of this empathetic paradigm. First, it requires a deep comprehension of the structural barriers, the environmental, economic, and psychological hurdles that actively constrain human agency. Second, it focuses on true empowerment through informed choice. Instead of coercing or dictating how you should live, this model empowers you with a mechanistic understanding. It gives you the why and the how, which allows you to make truly informed, autonomous choices. And third, absolutely zero coercion. This is a highly supportive paradigm that works with you, not against you. And building your individual health capital doesn't just make you physically healthier, it actually cascades into massive macroeconomic and societal dividends. As you accumulate this capital, we see a broader reduction in health inequalities across society. On an individual level, this enhanced psychological and biological resilience leads to increased social acceptance, much sharper cognitive resilience, and enhanced success at work. This yields very real, tangible, long-term financial and productivity benefits. And that's not just for you, but for the entire economy. The ripple effect here is absolutely staggering. I want to leave you with a provocative thought to reflect on as we wrap up. If health costs absolutely nothing to build, and it all starts with your emotions and your everyday microadjustments, how much is your capital worth today? Think about those zero-cost microadjustments we just talked about. How might they radically transform your own biological and social wealth, starting right now? The tools are already in your hands, they're completely free, and they're just waiting to be utilized. Thank you so much for joining me for this explainer, and I really hope this empowers you to start building your health capital today.